Hey guys, Dr. Ben, founder of Well Health and Chiropractic. Super excited that you are watching this video. This video is intended as a training video, an educational video on some of the secret sauce of why chiropractic works and some of the tips and tricks of how do you get injuries healed. The beautiful part here is that I'm not the hero of this story. You are the hero of this story. Your body is designed to heal. Our patients' bodies are designed to heal. God gave us an incredible body. We're not supposed to have headaches. We're not supposed to have low back pain. Our discs are supposed to last a long time and not degenerate. I'm going to show you in this video how your body's supposed to work. And hopefully that will provide some answers with how we need to clinically treat the body. I'll give you some tips along the way there for our doctors. If you're a patient watching this, I am going to be using doctor speak, so just be ready for that. And a lot of this is clinical experience for me personally, but not just me. This is going to be, I have talked to so many other chiropractors who've given me so much knowledge and really tips that I've used clinically. I know that you probably have some too if you're another chiropractor, and feel free to use those. I would love you to add to this video. But we're going to be going over headaches, low back pain. I'm going to be going over all kinds of job-related injuries specifically. I'm going to teach you how to really understand the main injuries and physiology behind most sports injuries. This video is intended not only for doctors, but also for anybody doing a new patient exam. So that way we can relate with our patients, because right? As patients, if you don't know this, not all of us just know everything. We don't know everything about everything. We got to learn this at some point. So that's what this video is for. Without any further ado, headaches. What causes headaches? This is ridiculous. Why are we walking around with headaches? Really, there's a couple of main reasons that we have headaches. I'm going to get one right out of the way here, and I'm going to just use dehydration. That's one thing that if you, when you're dehydrated, you generally get headaches. I mean, your body produces about 1 liter of cerebral spinal fluid, excuse me, per day. And so basically what that cerebral spinal fluid does is it gets produced by your meninges and it flushes throughout your brain, and it actually is what's going to carry the metabolic waste of thinking, right? So when you flex your muscles, your body makes lactic acids. When your brain flexes, it has metabolic waste. We call these beta amyloid proteins, and that cerebral spinal fluid is going to help flush that out of your brain. It goes down from your brain down your spinal cord. Actually goes down and exits towards the bottom of the spinal cord. By the way, true story, beta amyloid proteins has been shown to cause Alzheimer's. So when these proteins sit on your brain, they actually just rot your brain and literally causes neurotangles and Alzheimer's. It's been increased with multiple sclerosis. There's a direct study. So if your body is two things, number one is not producing enough cerebral spinal fluid, that's really bad. And God's going to get your attention by giving you a headache, right? Because he knows that beta amyloid proteins can't sit on your brain, so it needs to flush it out. And if your body produces 1 liter of cerebral spinal fluid per day, how much water should we be drinking? More than you're probably drinking right now. The rule is half your body weight in ounces, but you probably need to drink a lot of water just to get your brain to function the way that it's supposed to. The other thing that happens, and this is going to be a chiropractic thing, when your neck stretches out, what that actually does is it takes where your spinal cord is that's supposed to be nice and loose, and it tightens it. And when it tightens it, it's like squeezing a garden hose so that your cerebral spinal fluid can't circulate. And they've actually found some directly correlated research studies that showed when you lose that curve in your neck, you pinch off that cerebral spinal fluid flow, and that increases multiple sclerosis. And that's a direct study. So that's a big deal. So that's why what we do works, just starting with water. And then, of course, when we adjust the neck, that's what fixes it. Now, we get back to headaches. Sorry, I get so excited about that. Oh, run out of pins here. Okay, so a couple things that we need to know is how do headaches work? The number one cause really of headaches, besides dehydration here, is going to be sitting over a desk or an old whiplash-style headache. So if you're somebody who sits over a desk like this, oftentimes we damage these little muscles in the back part of our neck. Now, can you remember what those are called, chiropractors? Those are called your suboccipital triangle muscles. Okay, so there's 4 of them. They make a triangle. You have one right here called your rectus capitis minor, one right here called your rectus capitis major. We have one out here to the side called your oblique inferior, right? And then your superior is down here, I believe. I might have got those backwards. But it makes a little triangle. The purpose of these muscles, are you ready for this? The purpose of these muscles are to move your neck. These muscles are not designed to stabilize your neck. When people have whiplash, we stretch and tear these ligaments in our neck, and because the ligaments, whose job is to stabilize, can't stabilize, the muscles now have to stabilize. And because of that, they get little injuries in there. Now that could be just sitting over a computer all day long. You know, these muscles, little muscles, imagine if you flexed your muscle all day long, these little muscles get little injuries inside of those muscles. So they don't work right, is basically the moral of the story. And there is a nerve that exits right here. It's between the first and the second bone in your neck. And that nerve comes up the back part of the neck here. It's called your greater occipital nerve. That is your main headache nerve. That's the nerve that comes up the back of the head. It goes behind your eyeballs, goes by your temple. That's your main stress headache nerve. By the way, if you have these little muscles spasmed out here, it could be because the bone's in the wrong position. It could be because there's injury to those muscles. But if that muscle spasmed out here and you go home and you take, you know, Tylenol stress relief or whatever, what does that do for you? Nothing, right? That's going to remove temporary. It removes the pain signal is what it does. So you don't feel the pain signal, but when that Tylenol wears off, you didn't fix anything. So that's why that headache keeps coming back. So clinically, chiropractors, what we obviously have to do is the number one thing that's going to spasm out these muscles, again, is whiplash. So those bones are in the wrong position. Now, when the bone's in the wrong position, the muscle has to spasm down. It locks up on that nerve, causes headaches. So when we adjust that vertebra, it allows those muscles to cool back down, and that nerve doesn't fire, and that's how we fix headaches. Awesome. That's the number one reason by far we have headaches. Now, migraines are a little bit different story, but they're still the same story. So migraines are basically this, plus this, and generally, migraines are going to also include hormone issues, okay? Which we'll talk about. If you don't know much about hormone issues, our Food University is a big resource to help you balance your hormones. But even then, we have tons of people with migraine headaches. Honestly, migraine headaches will come in, and generally, the biggest thing I see clinically is that they're going to have more injury to these little muscles. So you have to strip that out with a technique called ART or suboccipital release. Chiropractors, you know how to do this. But we have to strip the scar tissue out. That's usually the main difference in migraines, is really these muscles are just more, they're more tight. It's so funny because people come in all the time. They've seen their medical doctor. They're on these terrible medications that will just trash your liver to try to prevent migraines. And the medical world just doesn't quite get this that much, which is shocking to me. If you specialize in headaches, to not understand this. But people come in 20 years of headaches, literally 20 years of headaches, and we will adjust their spine, strip out those muscles, and it's gone. Migraines are gone. And we have tons and tons of testimonies about that. So that is the number one thing with headaches. Now, I do want to take this opportunity. You're going to see here people that have a lot of numbness and tinglies into their shoulders, and these muscles that come the base part of the neck down to the shoulder blade. So I'm going to just really crudely draw this here. So your shoulder blade kind of looks like a little triangle right here, all right? And then your arm's attached over here. That's your humerus. It comes down your elbow, bends, and then there's your hand. Worst drawing ever, but it is what it is. So you have a muscle called your levator scapula, and it goes from the corner of this shoulder blade, runs up the back of your neck, and it actually hooks in the back of your skull as well. And of course your shoulders themselves. This is not to scale, so no judgment here. So your skin is kind of like this, right? So this is kind of how your shoulder, whoa, that is great. So anyway, so this right here is the knot that you're feeling like. If you push right here, generally most people have a knot right there. And what that knot is that's where these muscles are crossing over your trapezius muscles. They come up like here, and there winds up being this little knot that happens. What this generally is when that knot's up is generally somebody who has had any whiplash, you're over a desk too long like this. This muscle is trying to pull your neck back, right? So it's trying to pull your neck back in this position, and it winds up spazzing out that muscle and causing these trigger points on the top part of your shoulder blades. So we fix those by fixing the neck, strengthening the muscles in the back and the retraction muscles. And again, you should know clinically how to do that. If you're a patient watching this, talk to your chiropractor. We'll show you how to fix that up. So pretty cool stuff, right? That is headaches. Now, let's talk about low back pain. So low back pain, number one, is your back supposed to hurt? No, it's not supposed to hurt. Your back is supposed to feel really good. Are your discs supposed to last? Yes, your discs are supposed to last. So low back pain. So the way that God designed your body is you have a brain. Spinal cord. So your spine is like this, and chiropractors, you know this. We got all our bones here in our back, and then we have discs in between these vertebrae, right? So just so we're clear, we have, the blue is the disc, by the way. It's a thick piece of cartilage. We have 24 of these vertebrae. We have 7 in our neck, 12 in our thoracic spine, 5 in our lumbar, and then we have some few sacrum bones. So we have 24 vertebrae, and then we have these discs here too. So most people that come in with low back pain think one thing. They think that their low back pain or their disc herniation was caused by one thing. Does anybody know what that one thing is? From picking up something heavy. They say, Dr. B, I know exactly how that happened. I was working on my truck and I had to pick up this fender and I heard a pop and I blew out the disc in my back. Okay, that's actually generally not at all how it happens, just so we're clear. How your body works is research shows that your discs are so strong that I can compress your spine so hard that I'll explode the bone before I'll explode the disc, because your discs are that tough. The problem is when your vertebra shifts out of position, now you're putting abnormal load on these discs. You bend over to pick up a sock and blow out your back. Okay? So it doesn't have to do with how much pressure you're putting on your discs. It has to do with the positioning of your spine in relation to your discs. Now, there are positioning that you can do to put more torsion on your back for sure. Bending and twisting is put more pressure on your disc, but right now I'm bending and twisting. Watch this. I picked up a chair. My back didn't blow out. Why is it blows out sometimes and not other times? Well, it's because our back gets weak because our vertebrae get out of position, and eventually we wear that down, we lose that stability, and we herniate those discs. So the fix for a herniated disc, right, is not picking anything up heavy. It's making sure that we move the vertebra back into the correct position. Because remember, you are the hero to this story. Your body in the correct position will heal itself. Your discs will heal themselves. Yes, even if you have a herniated disc, it will come back into position and it will heal itself. Now, I do want to take a second here to teach you about the disc in general, because this is a really big question. So that is what a disc looks like. It's a circle. That's like the top view, and it's got all these concentric rings in it. These are called annular fibers. Okay, and that's what your disc looks like. And in the middle, we have this little jelly. You've probably heard of this. It's called your nucleus pulposus. Pulposus. Anyways, so that's your disc. So when you have a herniated disc, basically what's happening is this nucleus is starting to rip through these fibers. Okay, so if it rips through that fibers and it comes like this, you know, that's going to be, we call that a disc bulge. Now, honestly, this actually probably hurts the worst because there are pain fibers associated with these annular fibers. So when you bend over and that nucleus rips through a layer of that disc, that is actually going to cause a significant amount of pain. What that does, because it pushes this out, and this is a closed system here, it'll actually cause the edge of your disc to bulge a little bit, okay? And when it bulges, remember the way that this is sitting, there are nerves that are exiting your spine, right, like this, and it'll smash on those nerves, okay? And that will cause back pain, okay? And that can cause that shooting down your leg pain, not good, okay? So that's going to be like a grade 1, and that would what we would call a disc bulge. Where's my thing? Okay, here we go. That's your disc bulge, okay? The second thing that's going to happen is a disc herniation. So in a disc herniation is where this nucleus has managed to herniate all the way outside of the disc, okay? And then remember, we've got this nerve, because your spinal cord sits right here. So that nerve can pass here, and if that herniation, that nucleus pulposus, is physically pushing on that nerve, that's going to hurt, right? Now let me ask you, which one's going to hurt worse? If you have the hard edge of this disc pushing on your nerve, or this jelly, which one hurts worse? Right? The disc. So a disc bulge hurts worse than a disc herniation. Okay? Y'all with me here? Now there's another one that's called a sequestration. This is what happens when this has come all the way out here, and now this jelly actually like stays out there. Okay? So it's actually kind of separated out, and that's ripped through, and that jelly is hanging out. Now it's living in the same place as this nerve. It's trying to live in that space, and that jelly is in there smashing on that nerve. Listen, not cool, doesn't feel great, but your body will dissolve that disc. That's how that's going to work. Your body will dissolve the nucleus of that disc, which is going to be that jelly part. Your body has no problem dissolving that. If we realign your vertebra so that there's no weird pressure smashing that disc out, or that nucleus pulposus out, then your body will heal. It's going to take 6 weeks for that thing to get dissolved, whether it's a herniation or sequestration. It's going to heal itself in 6 weeks. If it's a bulge, it's going to take at least 6 weeks, if not longer. But the beautiful part of a bulge is we haven't compromised the integrity of that disc. So because that disc is still intact on the edge, a disc bulge is much better for you because it's not broken as bad. Even though it hurts a little bit more, it's not broken as badly. Hopefully that's what you understand here. The big takeaway is with our low back pain and our discs, everybody thinks it's like your disc herniated out. Most of the time, that's not actually what happens. Most of the time, your vertebra has shifted out of position and your muscles are locking down so that your back doesn't move anymore. You may have torn some part of this fiber, you may have strained some of these ligaments, but it's usually not that disc that's always ripped out of your or the middle part of your disc is herniated. Now, even if it is herniated, you walk in the office, this is exactly what we do. The medical doctor is going to want to come in here with a knife and cut and clean and trim all this up. Now listen, there's a time and a place for that, but it is very rare because when you introduce a knife, what you're forgetting is that we have, oh man, I'm going to try to draw this. You've got bone through here, you've got a big old bone like this, right? You've got all these muscles right here. There are tons and tons of muscles that run up and down your back. So you are taking a knife and your skin is like right here. So you're taking a knife and you're ripping through all of this stuff in order to try to fix your disc. So you could imagine back surgery is so rough, and the reason it's so rough is because it is destroying all of the good stuff in your back to try to fix the bad thing, okay? And that's why that's such a big deal. And if there's anything that we can do that doesn't involve a knife to fix this, that's going to be a win. By the way, an injection, all an injection does is sticks a needle in here, puts corticosteroids in there as an anti-inflammatory and a pain stopper to try to make it so it doesn't hurt, but it doesn't fix the alignment of your vertebra. So that's why the best treatment for herniations, disc bulges, back pain is to realign the vertebra to restore the mechanics so your body can heal itself, because remember, you are the hero of your own story. So now I want to teach you about piriformis syndrome. That is a big thing that walks through our door, is piriformis syndrome. And you'll see how these are all related to job injuries here in just a second. But piriformis syndrome, so your body looks like this. This is going to be somebody who's got some really special feet. Okay. That's your arms out here hanging out. They may as well mess it up with the hands too. Okay, so this is how God designed your body. So you have a pelvis that's kind of like a triangle, and then it comes out, and then your leg bones, your femurs actually come out to the side before they come in. Women have bigger, it's called your Q angle, by the way. So women have actually generally a wider Q angle so they can have babies, which is good. But what that does is makes more weird angles in the body that can cause back pain. So let me show you how to restabilize your pelvis. The number one pelvic stabilizers in your body. If you have low back pain, the number one muscle that we need to strengthen is our glute muscles, our butt muscles. That actually strengthens and stabilizes our back. Now, why this is such a big deal and why I'm drawing this crazy triangle up here is you need to understand that when somebody has piriformis syndrome, there's a little muscle that goes sideways from your sacrum out to the side of your hip right here called your piriformis. And it's about this big around. It's the size of a hot dog and it runs sideways through the side of your butt. Now, you have nerves, specifically your sciatic nerves, go underneath of that muscle and down your leg. Okay? So the trick here is that when this muscle is really tight and spasmed, it's actually smashing on your sciatic nerve, which causes sciatic pain going down your leg. The number one thing that causes piriformis syndrome is sitting, specifically sitting with your leg propped over like this. So this is going to be all your truck drivers, people that sit for a desk, drive. If you're a salesperson, you're on the car all the time. Maybe you're somebody who flies for a living, like you're in an airplane all the time, or you're a pilot. You're going to have tons of increased piriformis syndrome with those occupations. The other thing we're going to see here is we need to see our glute med stability. So you have a muscle, so you got your glute max, which is your main butt muscles. You have a little muscle called your gluteus medius, right? So basically it comes from here and it goes to the side like this. It's kind of like your piriformis, but it's the main side muscle, okay? And why that's such a big deal, actually it's going to be over here like this. Why that's such a big deal is if you pick up one leg, right? So imagine if you have a triangle and I was to pick up this leg and bend this knee, okay? What's going to happen is you would expect this triangle to drop down, okay? Clunk. You'd expect it. If I pick up my leg, my hip's going to drop down, but it doesn't. When I pick up my leg, my pelvis stays stable. Why is that? That's because this muscle fires and keeps my whole triangle up, this one muscle called your gluteus medius, and it keeps your triangle straight. So if that muscle, your glute med, gets weak, what's going to happen is you're going to, when you pick up your leg, every time you walk, you pick up your leg, your pelvis is going to drop. And when your pelvis drops like that, it's going to cause increased tension on your low back. So your low back muscles are going to have to start firing in here, and it's going to cause all kinds of low back pain. Whoa! So to stabilize your low back, we think that we need to do all these back exercises. We really need to be doing butt muscle exercises, and that's going to restabilize your low back. Okay, so again, piriformis syndrome, glute stability, and then obviously what all those do is they make the bones in your body move out of position. And that's why as chiropractors, we move the bone, which is great, but we have to restabilize the spine and the pelvis, or else what's going to happen is the bone's going to move right back out of position. That's our trick. So those are really the biggest issues with low back pain. Now let's start switching into specific injuries to specific jobs. Okay, so these are your job-specific injuries that you have to know. Somebody comes into the office and says, I drive a truck for a living. Now, this isn't just truck drivers. This can be somebody who flies airplanes, who maybe is in sales and they're in their car all the time. They have a big territory, or they're just in the car a lot, right? This is going to be anybody who drives a lot. We're going to see that piriformis syndrome. Remember, that's going to be because their leg is going to be flopped open, which is going to stretch, or it's going to spasm out that piriformis, and then they get out of their car. This is what they're going to say. They say, when I get out of my car, I feel like I have to walk for 4 or 5 minutes to loosen this up, and then I'm good. That's classic piriformis syndrome. And again, to fix that, we have to strengthen those muscles, but we have to move the bones because your pelvis winds up getting shifted. We have to adjust them and then restabilize those muscles and stretch out that piriformis and gets rid of that very quick. They're going to see a lot of head forward neck pain. Okay, so head forward neck pain, we're going to be, remember those muscles we talked about, the suboccipital muscles, your levator scapula muscles. You're going to expect them to have headaches, big time, right? The bouncy seats. Okay, so history lesson on trucks. Trucks used to, before they had air ride suspension, okay, so they have these airbags. So today's current trucks, you sit in them, like the road can do this, and you just kind of float like this in your truck. It's better, still not amazing. If you had to do that all day long, you'd wear your back out too. If you're a truck driver or a driver, you know what I'm talking about. How it used to be was more like your car. So it was just a spring and a seat. So if the road hit a bump, you hit a bump. And remember, truckers cannot avoid potholes like you can in your car. So if you're driving in a truck and you're in one lane, you're in a groove in the interstate. You've seen those grooves? Truckers make those, and they just stay in that groove because you can't just be making a truck do this. There's a pothole, you're going to hit it. Toom, right? So they're just pounding on that back, and that just wears those discs out because what's going to happen is, actually I used to work at a loading dock when I was in college, but these truckers, remember, they're not just driving. They drive and they get out of their truck, and a lot of these guys have to get into a fork truck. They might have to physically use a hand cart to unload that big truck. Sometimes they're fortunate enough where somebody else will unload the truck for them, but they'll wind up jumping in and out of these big trucks and off of those loading docks. So the way that it works is a big truck will back their big old trailer in the back of the loading dock. You've seen all those, so they can unload it. Well, that loading dock is about this tall. So how do you get from here down? Well, you could walk all the way over to the stairs, but what do you usually do? You just jump off of that dude. Well, that's going to mess your back up, particularly you've been sitting all day long, and now you're doing like a 5-foot jump, and you do that 4 or 5 times a day, every day. Eventually your back gets worn out, and that's going to cause all kinds of back, specifically disc issues. Truck drivers, man, they're on the road a long time, so nutrition is a really important thing to them. Snacks, man, they're really, really notorious for terrible snacks. Some truck drivers are really good though. They'll eat vegetables when they're driving, because you can do carrot sticks and celery. If you're like me, like if I'm doing a long trip, I kind of have to always be eating something, so I need like carrot sticks or something. But very important, nutrition. Truck drivers are usually interested in that. Why this is a big deal is blood pressure, man. You have to pass a DOT physical to drive a truck. To fly an airplane is even tighter, and probably not drive a sales car, but you have to pass a DOT physical for these truck drivers. And if your blood pressure is high and you cannot control it, you will lose your job. The state, whatever state you're in, will pull your license, your CDL license, and you can't drive. So blood pressure is a huge deal. Remember, the nerves that control your heart come out of the base part of your neck, right? Chiropractors, if you're all day long driving a truck like this, you are going to be damaging these nerves, not to mention the fact that maybe these truck drivers used to play football and baseball and basketball. Maybe they've been in a car wreck. These nerves are going to get damaged, and that's going to cause their blood pressure. So blood pressure is a real big deal, and it's usually because of neck issues. We adjust them. I don't know that we've ever had a truck driver in here with high blood pressure that we adjust them, it didn't at least stabilize. They usually get better, but they at least stabilize. So just remember that. Okay, desk workers. Okay, this is going to be a real big one here. This is most people, by the way. Most people come in, and if you don't even work at a desk anymore, at home you're sitting down, maybe you're playing on, you're playing on your phone is the worst. So what are desk workers? If you have on your job, you work at, I don't know, you're an accountant. This is what you do. This is you, okay? Neck pain, headaches, tinglies. That's all day long. You're going to have those suboccipital triangle issues. You're going to have that levator scapula. You're going to get this pressure point in the upper part of that shoulder blade like we talked about. The second thing you're going to get is you're going to see a lot of hand numbness, tingles in the hands, right? That's going to be because we're like this all day long. What happens is our chest muscles get stronger than our back muscles. So our chest will start to come in. You'll see these people because their arms are rolled in like this, and their back muscles are real long and weak. Their chest muscles are going to be short and tight. Okay? Because of that, they'll pop ribs out behind their shoulder blade. So chiropractors, make sure you know how to get this rib back in here. And you can know that by you pull the shoulder blade across like this and you feel down their back. And if you feel those rib heads and they're like super sore, you can do a posterior rib move. It looks a lot like an A to P. Put those rib heads back in and they're going to go, whoa, that's amazing. We'll talk about that with baseball players here in a minute as well. But we take the pressure off of that, that's going to get a lot better. The other thing that happens, and by the way, this is a chiropractic thing, because if you're here, I can put those rib heads back in, but if your bones are still going like this, it's going to just go right back out. So as chiropractors, we have to restore the biomechanics so we can restore this positioning of the shoulders, and that's what fixes you. Okay, that's a big term fix. As far as the tinglies are concerned, a lot of times people say their hands fall asleep at night. That's because because they're doing this all day long and their posture is terrible. You have your pec minor, if you remember that, it comes off your coracoid process and it fans down over the top 3 ribs. It's a muscle that goes like this. Underneath of that pec minor muscle, remember you got your pec major muscle, your pec minor muscle, goes your brachial plexus. Okay, that's that big nerve. It's like your sciatic for your leg. This is your sciatic for your arm. Okay, so brachial plexus comes underneath of your pec minor. When you're like this all day long, that pec minor will get shortened. A lot of times when these people are sleeping, then that pec minor will mash up against that brachial plexus and cause their hand to go numb, specifically these 2 fingers right here. Cool stuff. Anyways, by the way, I used to suffer with this myself. If this is you in the middle of the night, push your arms as far away from your chest like this, and it'll go right away. And if it does go right away, then you know you've got a pec minor tightness, so you can stretch the pec minor out, and you have to get adjusted because that's what's actually going to fix that. Cool stuff. And then we also have to strengthen our rhomboids, because the rhomboids are the muscles between the shoulder blades here that are making our shoulder blades roll forward. So we have to strengthen our rhomboids with specific exercises, and then of course we fix that pain. Or these people are also going to have a piriformis syndrome. You sit at a desk, just like a truck, man. That leg's going to roll over, going to have piriformis syndrome shooting down your legs. Desk workers are notorious for dehydration. They're just not drinking enough water. It's kind of a pain when you drink water at a desk all day long. You got to go pee all day long. Well, and they'll start drinking coffee and tea to keep themselves awake, specifically if you're in a cubicle. when you do that, you get dehydrated, right? You're going to start getting headaches. So we got to make sure they're dehydration, and then again, nutrition and snacks. Very important. You know, you sit at a desk all day long and you're bored, you're going to reach for some snacks also. So no judgment there, okay? All right, electricians. This is kind of a fun one. So electricians, if you have an exam on somebody who's an electrician, here's how you're going to speak their language. If you've ever watched somebody, we built a house not too long ago. Electricians have these weird jobs where they hold really heavy things, and then they have to like put a screw in like right there, you know? So they're holding it with one hand, usually standing on a ladder with a screwdriver, doing one of these right here like this. Or they've got this one little wire sticking over here, and it's like they're like hugging something, and they wind up getting in these weird positions, and they have to like torque down. So they have tons of neck and shoulder pain. Remember, all those lights and ceiling fans in your houses, who puts those in there? Your electrician does. So they're physically holding this cool thing, and it might have glass on it and maybe fake crystals or whatever it's got on it. They are not allowed to drop it. So they're holding something that weighs 40, 50 pounds, and then they're trying to screw that dude in the ceiling. Your neck and shoulders would hurt too. So these guys are going to have tons of ribs popped out of position, neck pain. By the way, they fall off these ladders all the time. So if you're an electrician, you're welcome for me telling you that. They fall off these ladders. It's super common for them to come in with whiplash. With your electrician, HVAC goes in here. HVAC is going to be your heating, ventilation, air conditioning people. These guys, man, they're picking up, those HVAC units are really heavy, and they don't really have a team usually, so they have like a whole air conditioner, and it's their job to get it all the way behind your house and on that pad. So they'll hoss that thing. They might put it on a cart to get it somewhere, but there's usually, at any point, they are picking up something that weighs a couple hundred pounds. So that's where you're going to see your low back injuries with your disc injuries a lot. Okay, you're also going to see your wrist and hand injuries. Of course, we talked about here. So we're going to do some ART here. So if these people are going to have carpal tunnel, that's going to just devastate their job because that reduces their grip strength and numbness in their hands. You can't put little screws in if you got little numbness in your hands. So we got to make sure that works. And then, of course, if you've ever stood on the rung of a ladder for 6 hours a day, your feet get destroyed. So these people are going to have a lot of plantar fasciitis, and they're going to get their naviculars out in their feet, cuboids, all that fun stuff. You have to put those back into position. Anyways, that is electricians. So the next one here is police officers. Man, this is a good one, man. If you have a police officer, this is going to be obviously your sheriffs, you're really going to relate to them. Police officers have a weird job where they're sitting. So remember, they're like truck driver, you got the whole neck injury, shoulders, all that stuff. That piriformis syndrome with your leg over. But then they sit, and then they go like running at 100%. So imagine if you're like in your car, and you're just kind of like, you're like, hey, okay, that guy wasn't speeding. Okay, maybe that guy was speeding. And then all of a sudden, boop, 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 something comes on your radio where there's like a robber or somebody like doing something bad. Next thing you know, your adrenaline is spiked. You are driving as fast as you can. You might have to get out of your car and just run after a dude where you haven't stretched, you haven't warmed up. Imagine if an athlete did this. You know what I mean? Imagine if you went to like, I don't know, a track meet, and you were like a spectator in the stands, and then they just said, hey, why don't you just go ahead and run 100 meters as fast as you can? No stretching. What's going to happen to you? You're going to destroy your body. That's what happens to our men in blue, men and women in blue, is they do this. Now, firefighters are kind of in the same boat as well. They're just, you just go from 0 to 100 as fast as possible, and it just wrecks your body. Police officers, I don't know if you know this, but they wrestle for training as part of their qualifications to be a cop, is you have to train. I believe I don't know when you have to do that, maybe once a year, once every 6 months. They literally have to wrestle as part of their in-service training because they need to know how to get down the bad guys. Well, if you're a wrestler, you're going to mess up your back. You're going to have neck issues, back issues. One of our buddies, he was wrestling, he kept getting knocked out during this. This is a big deal. A hot Kevlar uniform. Our men and women in blue are wearing, if you ever see them, they're wearing their bulletproof vests, their bulletproof jackets, which thank God that we have those. Those suckers are hot, super hot, particularly in the summer. So they're wearing these jackets, which, by the way, if you ever smelled them, they stink because you sweat in those things, and you probably can't fill in your laundry machine or your washer. So they're on these Kevlar jackets. Well, imagine inflammation will cause inflamed discs. Inflammation will cause back pain. Inflammation is the opposite of health inside of your body. Well, if you're constantly sitting in this Kevlar jacket and your muscles are inflamed, it's going to increase the heat, right, in your back. The same way that like a normal belt will actually make your low back get hot. So if you're wearing shirts that are tucked in and you're driving a long distance and your seat's pressed up, your back's pressed up against the seat, you get sweaty in your low back. Well, a police officer, like that's like 10 times worse because they have Kevlar. So if they have any back injury, it's just going to get heated, which is a bad thing. Further back, right? They're going to have tons of piriformis issues, obviously whiplash, which is going to be the headaches. They're driving their car, headaches. And then the big thing is police officer, their hot button is they need to feel agile. So most of the time when they're like young into the force, they're going to feel like, yeah, man, I can do anything. When they've been a cop for like 10 years, they start to feel like they're old. And they need to feel agile to feel safe on the job. So that's what, as chiropractors, we can do to help them, is really increasing their agility, which is really going to help them to stay alive and protect us, which is a big deal, okay? Travel, again, I already covered this one, sales, drive or plan, I should say plane. And then this is our piriformis. So obviously, this is going to be just like truck drivers. So piriformis, head forward, specifically going to get a lot of laptop issues with your salespeople. So you're going to be forward like this. You have those rhomboid issues. They're also going to have low back and headaches. And again, this is seats. If you've ever slept on a plane before, just think about what that's going to be like. It's just awful on your neck, man. And those neck pillows are useless, man. I mean, they're better than nothing, but they just don't do. It's not like you're sleeping in your own bed. So you're going to have tons of neck issues, a lot of neck stiffness, and they love going to the chiropractor because it's better. Dental hygienists and dentists, listen, dental hygienist is actually the #1 profession that quits their profession because of a physical injury. Did you know that? It is the #1 profession that gets quit because of physical injury, and that is dental hygienist. And that's because how a dental hygienist, they wind up sitting on a stool generally, they got their lights, and they're winding up in this position for hours at a time, right? So, they're doing this right here. Like if you and I had your arm up like this, and it doesn't feel like much of anything when you do that for like 5 minutes. But I would encourage you to try this, stay in this position for 15 minutes and see how you feel. You feel like trash. These people have tons of carpal tunnel, lots of shoulder injuries. Those ribs that we talked about behind the shoulder blades, every single one of them have those ribs just rib heads are way out of position, and it's really, really bad. Obviously, because of that, blood pressure spikes, massive headaches. I don't know a dental hygienist that doesn't suffer from headaches. Usually they're having massive migraines because they're locked in this position, and that's that suboccipital triangle. It gets hammered, and obviously it is not good. Shoulder, arm, hand pain, rib, that's just your dental hygienist. So that is the main part of your professions. Now let's talk about some sports injuries, okay? Now these are going to be, obviously, there's a lot of injuries. I just picked, a couple of the top main sports so that you all can understand how these work. But if you're reading someone's history and they say, listen, I used to play football. If you're watching this and you used to play football, obviously you're going to have low back pain with football. Why do people get low back pain with football? It's not actually being hit. It's usually from getting strong to play football. Football players do a lot of squats and hack squats and back squats and heavy lifting to work on their big old muscles to hit people. But that working out, when you're in high school and junior high lifting weights, you're generally not having great form. So they wind up pulling their bones out of position when they're younger. And then maybe when you're in college, you begin to learn how to work out better with better mechanics, but the damage has already been done. The bones are out of position. So what we do is we need to realign those vertebrae and then re-strengthen and retrain those muscles. By the way, if you're somebody who's actively, if your kid's in football right now, have them get adjusted, because if we can keep those bones in the right position, that'll prevent them from having like a lifetime of back pain because of it. Obviously, whiplash, man. Obviously, whiplash. You get your football player, you're going to get hit. You have whiplash because they do a lot of cutting back and forth. You're going to have knee and ankle injuries. So those are going to be really important. They're going to mess up their spine. If your knee and your ankle are messed up, it's going to cause you to walk funny. It's going to wear out your spine. So when we have these old injuries come in, somebody says, I play football, I have knee injuries, you know that knee is going to translate to low back pain and hip issues. Okay, baseball players, softball players. What this is going to look like is baseball. Think about that. Obviously, we have shoulder pain. This is what I was talking about. When we lose with the rib pain, when these ribs pop out of position, which almost all baseball players have that, those ribs will actually pop out behind your shoulder blade and they'll push into your shoulder blade and actually will grind on that shoulder blade. And they're going to feel like they have shoulder pain, but it's actually the rib head pushing against that shoulder blade. There's actually a research study that showed that when you put those rib heads back in, you will increase a fastball of the pitcher by 3 to 5 miles an hour. Whoa, big deal, right? 3 to 5 miles an hour is huge. As a matter of fact, one of our I'm going to forget her name again. One of our professors in school, Janet Evans. That's right. So there's an Olympic swimmer, Janet Evans. I think she's won like 5 or 8 gold medals. She's one of the more decorated swimmers. She does this technique, and she's a little bit older now, but it's called windmill. Like, so normally when you do backstroke, you come back and you grab the water and you do this motion right here. She was a windmiller. So she's an old school windmiller. So she would go straight down like this, but she was wicked fast. When she was, I think, 16, she was in junior nationals, and she was having so much pain that she was considering retiring at 16 in junior nationals because her shoulder hurt so bad. Well, my professor at school, Dr. Montgomery, he was actually her chiropractor in California, and he said, you got some rib heads out. He put those rib heads back into position. I had to do it a couple times. That weekend she went and won all of her junior nationals, and then, later became Janet Evans, and won a whole bunch of gold medals. So just an incredible thing. You're definitely going to have that for swimming. I guess swimming down here, we'll talk about that again. But again, that's going to be those rib heads with your baseball throwing injury. Now, softball, there's actually some research that shows that there is a high incidence of scoliosis with softball pitchers. Because remember, softball pitches underhand, right? So they're going to have a lot more scoliosis for whatever reason. And they're going to have, softball players, by the way, have massive thoracic subluxations and bone out of position, probably worse than baseball, which is kind of funny, by the way, talk about this. Of all of the sports injuries that I've ever studied, the worst one for your body is the pitching motion. There is nothing natural about a pitching motion. So when you're back like this and you're loading your shoulder, you're asymmetrically loading your hips, you never throw with your left hand, you don't practice that. So imagine if like you went to the gym and you just lifted like one arm and you did like one side and one leg, like your body would look weird. Baseball players do that all day long because you don't do the other side. And that's why they wind up having these really unique injuries. That's also, I should have put headaches on here because that levator scapula, baseball players are notorious for headaches. And obviously, by the way, low back pain is really big. So one of the number one things that if you're a baseball player, particularly a hitter, hitting power comes from your legs and your core. So baseball players are the ones that spend the most time doing back squats. They want their legs and their butt to be really, really big muscles. So they spend tons of time on back squats. Because of that, again, we talked about that before with football players, is they get a lot of low back pain because if you have any type of bad form, you're going to start to shear those discs in your low back. Obviously not good. Basketball players are going to have a lot of whiplash. Basketball players run into each other all the time, and you're going to see whiplash. You're going to do your fadeaway and you get smacked. You're going up for the ball. Obviously, it's not good. You're going to see a lot of knee and ankle issues because if you've ever, they're constantly jumping, and when they come down, there might be somebody's foot that's underneath of them now that wasn't when they jumped. So they land on their foot, twist their ankle. Obviously, that's going to be ankle and knee injuries, which of course comes into your low back pain, as we talked about before. Golf. Again, there's more injuries to all these sports, but you can just imagine. I'm trying to give you the physiology, like this is how we think about sports injuries, so we can make this a discussion. Golf, obviously low back pain. I was a golfer and a swimmer, so we have notorious for shearing discs in your back because we go into this golfing motion and you wind up basically straining your low back and shifting it, and golfers have to get adjusted. It's another one of those asymmetrical motions. You go one side, you almost never go to the other side. You're never hitting left-handed and right-handed. You're only hitting right-handed, whichever one you are. And you're going to have low back pain from the discs and twisting. And then obviously there's a thing called golfer's elbow. It's called medial epicondylitis. So you're going to start to see them. And that's from holding on to the club and swinging out like this. So you're going to get this medial pain inside of your elbow, and that's going to be really a scar tissue buildup. By the way, tennis is going to be the other side. So tennis elbow is a lateral epicondylitis. It's on the outside from doing the opposite motion. Actually, this way. Anyways, swimming, obviously shoulders. Listen, if you can understand how the rotator cuff works, you will be able to master swimmers. And I'm talking about basically balancing the shoulder. So swimmers spend so much time strengthening your pec muscles and your lat muscles, but they don't spend very much time, because remember, out of water isn't that much effort. They use all of their effort to pull down like this. So because of that, me personally, when I go to the gym, I can do pull-ups, a lot of pull-ups. But if I have to push something up, I'm actually not very good at it, because my whole training was to, there's no effort out of the water. It was all pulling it down and in. So we're going to see tons of shoulder issues. Specifically with swimmers, you're going to see they start to look like this because their muscles are tight in the front and their back, those rhomboids get weak. So we really have to restabilize. I'm constantly, still in my lifetime, even though I don't swim anymore, like I did, you wind up having to strengthen these rhomboids to get those shoulder blades to pull back together, and that will relieve my medial shoulder pain. Specifically, you're going to get, they're going to have bicipital tendonitis, which a lot of people do this, but you'll get this pain that comes right down here, and you can put your finger and you can dig right in there, right on that bicipital groove, and it hurts like mad, and it's bicipital tendonitis, and it's going to get fired up when people that used to be swimmers or have shoulder injuries, when they're doing anything with their biceps, when they're doing pull-ups, they're going to wind up chewing up these muscles. Anyways, but it doesn't have to be that way if you can rehab that. All right, volleyball. Okay, volleyball players. They're going to be up, so they're going to have very similar injuries to your baseball players and even your swimmers. Lots of shoulder issues, lots of neck issues. Knee, man, volleyball players snap their ACLs like nobody's business, and that's because they're coming up and hitting as hard as they can and landing from as high as they could possibly jump. So they're jumping as high as possible. You'd think that happens in basketball all the time. Yes, they jump really high, but not everybody does. In volleyball, they're jumping as high as they can every single time, landing from 2-3 feet off the ground, boom, and they're landing sideways, and when they land, they can pop those ACLs big time. So to protect the ACL, we have to strengthen the butt muscles. Remember we talked about which muscle? The glute med muscle. Glute med will stabilize the knee, and then they wind up snapping ankles all the time, so they have to wear their active ankles. And again, knee and ankle issues equal low back pain. So that's where you're going to see a lot of that with our volleyball players. Soccer. Soccer is one of the most brutal sports that there is. Soccer is going to be whiplash, knee injuries, ankle injuries, because they're heading the ball. Soccer just runs into each other without pads. So obviously you're going to see all that. And again, knee and ankle injuries are going to be low back pain. The couple that I'm thinking about right now as we're doing this is going to be cheerleaders. Cheerleading, man, is brutal, particularly if you're a flyer. For some reason, they throw people up and they forget to catch them sometimes. My wife was one of these flyers, and she said every now and again, like, you just slip through those basket holds, and she would go down on the ground. She'd land really hard on her bottom. Sometimes, I mean, it's bad, They're also doing gymnastics, so you're going to get a lot of whiplash, a lot of shoulder injuries. The girls that actually have to catch them, remember, somebody's got to throw them up, and then they have to catch them, and they do these basket stuff. So these girls wind up, like junior high girls are catching other girls, like they hurting their backs, they're not going to the gym like they're not doing back squats and stuff. So they have to do all that, catching. And when the form goes bad, because there's no way to catch a human being with perfect form every time, it's just not going to work, they wind up having all kinds of back injuries and knee injuries. It's a rough world to be a cheerleader. Anyways, so hopefully you like that explanation rundown of kind of understanding that, and why this is such a big deal is as we're doing our exams, we need to be able to ask our patients intelligent questions so we can get intelligent answers. And then we can help lead them down the path of figuring out what's wrong with them and how we can fix. Because yes, we can go in with a set of x-rays and just tell you what's wrong with you. But at the same time, it's better clinically to know, what is your history? Did you play sports? What kind of job do you have? And based on what you're doing in your life, I can probably tell you without ever even touching you what's wrong with you, because it's pretty common, pretty obvious. And there's only, as you've seen, there's only a handful of things that affect everything. So it's not rocket science, but we want to best help our patients, and the best way we can do that is really understanding what their mechanics are and what their lifestyle is, so we can help them. Anyways, I'm Dr. Ben. Hopefully this was beneficial to you. Make sure you watch this as many times as you need to so that you can start to drill into your brain what causes our injuries. You don't have to be a doctor to need to watch this. If you are doing new patient exams, you definitely need to know all this stuff. Watch it a few times so this makes sense to you. It starts to become second nature, so you can start to think like a doctor, right? Think like a doctor. If you're a patient, you're watching this, this is probably pretty insightful. It ain't rocket science. This is not rocket science. If you have these injuries, then maybe we need to fix them up. And if we're not doing something that we could be doing to help you more, just let us know, because we will do any of the stuff we talked about. Like, that's what we do specifically here at Well. Anyways, I'm Dr. Ben. Hope you guys have a great day.